Okay, awesome. Hi, everyone. My name is Reach. I'm joined here with David and Philip, and we're continuing our online learning series, talking a little bit more about social determinants of health. As a reminder, we are the Stanford Healthcare Design Challenge that was launched with Longshot, Aditya, and Julia. We're working on bridging the gap between innovation and implementation, and our applications are due at the end of September. Briefly talking about our September programming, we have an awesome group of mentors and advisors and speakers throughout the month of September. And going into October, we also have great panels and mentors for our competitors. And our final pitch day is October 18th on that Friday. So going to the prompt, David.
Yeah, so our prompt we've generated through collaboration with all of our mentors and our judges with inputs from various organizations. And our prompt is relatively broad, but also focused enough that it makes sense for our first year. And our prompt is to design a financially sustainable and scalable solution tailored for vulnerable populations that effectively address their social determinants of health. To enhance engagement with healthcare and improve health outcomes. And that focus on social determinant of health is actually the topic we're going to be talking about today, and we'll introduce our speaker in a bit. But our judges, our 12 team of 12 judges now, our 12 teams will be judged by a distinguished panel of healthcare experts, each of them coming from a different part of the healthcare ecosystem. And we recently added a judge from InterSystems with a background in market intelligence, data analytics, and pricing strategy. And our judges will be focusing on five main axes. That is understanding the problem, solution value, feasibility of implementation, overall presentation, and product differentiation. So without further ado, our speaker today is Dr. Philip Polakoff. And it is a great honor to have him here, and his distinguished career in health and healthcare spans 40 years, 45 years, in fact, and includes clinical services, product innovation, network development, care management, organizational and business enhancement, policy formulation, communications, and financing. And he's a health transformation advisor and previously worked in product and network development, care management, organizational and business development, policy formulation, communications, and financing. He serves as the founder and CEO of Healthier We, a nonprofit organization dedicated to addressing critical issues of rural health. And Dr. Polakoff has a long list of honors and previous positions, including being shortlisted for the United States Attorney General position, senior managing director of a public traded consulting firm, advisor to numerous payers, providers, investors, employers, and labor organizations and public entities. He was chief executive officer and founder of Total Health Advocacy Partners. As an affiliated scholar at the Bill Lane Center, Dr. Polakoff is intimately involved with the Rural West Initiative, which focuses on rural health and healthcare issues. In addition to his work at the center, he is a consulting professor at Stanford Medical School. He is the author of 5 books and has published more than 200 articles. He holds degrees from Cornell University, Rutgers, and the State University of New Jersey. Rutgers, the State University of New Jersey in environmental sciences, Wayne State University, and Berkeley and Oxford, where he apparently played basketball with the former president of Yale University. So he is a very experienced man in all sorts of health related needs, and he's going to be talking about social determinants of health with us today. So take it away, Phil.
Thank you so very much, David and Reach Out. That was quite the introduction, a little bit ponderous, but let's leave it at that. We're talking about the social determinants of health, but I'd rather make it the drivers of health. And let's go back to the future. Health was put forth in definition by the World Health Organization in 1948 in its charter. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. When we look at a famous doctor, Sir William Osler, many years ago said, a good doctor treats the disease, a great doctor treats the provider. Treats the person. So it's really very relevant that we concentrate more on the person, not just the sick care model. And it should be a right, not a privilege, for all of us to have good health care, and change our system so it's more efficient, effective, and not as fragmented. So as we move forward, I think we have to think bold, start small, and move with passion and purpose. With the next slide, you'll see that when we talk about social determinants, or as we talk about the drivers of health, there are generally four major areas of action. And this was created by the Robert Wood Johnson Foundation probably a decade ago. Action one area is creating healthier, more equitable communities. That's where the community really is one and all, not just for the chosen few. Action area two is making health a shared value. So we all have the same. Right now, unfortunately, there's disparities and inequities. There's definition differences between the rich and the poor along different ethnic groups, the Black and the brown, and have a harder time getting chosen healthcare. The genetics make them more predisposed to certain disease patterns. You also have the different orientations in faith and what that happens. And if you're talking about rural versus urban, that's another divide. The rural areas are some ways similar as far as their healthcare statistics, but are very different culturally. So if you think about the farm areas of Wisconsin or Minnesota, that's different than the foresty areas of Montana, or different than the Delta areas of the South or the Central Valley of California. So how do we get more, in action three area, more cross-sector collaboration to improve well-being? And that's really where we're trying to promote the healthy American ecosystem, which is not only to deal with inequities on an individual health, but how do we deal with cross-sector collaboration with other entities or sectors that impact on health? So it could be education. Poor people are less educated, have a harder time with their health status than the rich who have more access to care. You could say with housing, the homeless are definitely hurting for decent health status. It goes on to transportation. How do you get to a hospital in a more isolated area? Technology, who has access to the internet, and how do we make that more comprehensive for one and all? And then strengthening this area for the integration of health services and systems. Right now, there's competition between them. There's data sharing, which is hard between one system and next. And now we have the whole issue of where does AI fit into the transition? It's a very powerful opportunity for betterment. However, we also have to never lose sight of the human aspect of health. So those are the four essential health action areas. On the next slide, we'll see the drivers of health in the action areas. So let's go through these rather quickly. Area one, creating healthier, more equitable communities. We have to address, build environmental and physical coalitions. Right now, there's a hard time observing climate change into one and all. It's fragmented between those who are pro and those who are against energy transformation. We have to have social and economic environment. Everyone's very concerned is where's the money for me, not where's the money for us. So we have to get that. And policy and governance, I use the 3 Ps. We have to deal with practicalities, policies, and political will. So we really have to make sure that we change the concern that incomes are prioritized over outcomes, but where we get some transformation, which is not easy. Change does not come easy in our society. Making health a shared value. How do we get more people with a common mindset and with commonly shared expectations? How do we get a sense of our community, whatever the community is? It could be a regional community, it could be an economic community, it could be a cultural community, but we really have to define our community. And civic engagement, how do we take our titles and become more participant in our small d democracy and have greater civility in our social interaction? So as some people say, it's better to be engaged than enraged. We put a lot more energy into negativity than we should put in optimism, spirit, and hope. When we look at the next one, fostering cross-sector collaboration, it's important that we look at the number and quality of our partnerships. And I think what the Stanford project that we're included in here today is doing that, to get more people involved at all levels and look for newer leadership that can bring us into the next generation, especially in the area of youth education. I think there's a great deal that we have to have better ways to develop partnership between parents, school districts, the board of directors of schools, the economics of the state, and whatever else. Investment in cross-sector collaboration. It boils down to, where's the money coming from? Unfortunately, we have a problem with public health not getting sufficiently supported. It's not been central to our thinking in the last 30 or 40 years. Having had the experience of being a commissioned officer in the U.S. Public Health Service in the early 70s, we collaborated and created the National Institute for Occupational Safety and Health, OSHA, National Environmental Health Institute, and the like. And that's not, you don't hear the words OSHA, NIOSH, workplace pollution as much as you used to. We hear more of the word violence, and we haven't solved the issue of how we're going to deal with gun control. And lastly, drivers of care becomes important. So are we going to be able to change our system to be more holistic, less fragmented? Keep in mind, the U.S. now spends $4 trillion a year on sick care and less than 2% on prevention. And who has access to care? The consumer experience can range from excellent to not so good. And that's a concern, especially for those of minorities and lesser income status. And then how do we get a sense of balance and integration? So we really have a great opportunity for successful transformation, but we do have to have leadership and commitment, no matter what the political party in force is. The next slide, please. So with this, it used to be known as the triple aim, but I made it the quadruple aim. How do we get better care for one and all? How do we have better health, as we talked about what the definition of health earlier on was, which is a state of complete physical, mental, social, and spiritual well-being, not merely the absence of disease or infirmity. And can we get a better price? Because people are priced out. In one place, you can get an MRI for $5,000, and in the next place, you can get it for $400. So unless you're a bright consumer, it's very hard to get value added. And let's, on that topic, are we making progress of the new model of value of care? Or are we still stuck in the fee-for-service model? So the quadruple aim is a goal. It's an objective. So when you look at things, we talk about in entrepreneurship with the terms OKR, which stands for objectives and key results. And we really do have to show specific bright spot data-driven stories. So moving forward, next slide, please. Critical steps. These are 5 steps to make transformation occur, but I would add a 6th. We have to convene, like you're doing with the Stanford Design Health Challenge. You connect, bringing people together. You communicate articulately with some degree of simplicity and elegance. From what I learned from a communication expert at Stanford, there are 3 words in communicating to others. You have to know the issue. You have to feel for the people you're talking to, not about yourself. And you have to leave them with some do's, what they can do. From there on, you have to collaborate and then commit to the change process. So the 6th C I would add to that is change. And with that, let me reinsert the 3 I's. You have to be interactive. You have to be interdependent. And you have to be interconnected. And with that, you get the people in a position where they feel that they are part of a team to make change. And lastly, the slide before we open it up to some questions is, in these times, if I is replaced by we, even illness becomes wellness. We can only work together to have a healthier rural West or a healthier America by working together. And we have a great opportunity going forward with spirit, hope, and energy to make this a better society, a more prosperous society, a healthier society for all, no matter where you live, what your background is, what your economic status is. But I do think we have a challenge for future generations to make their life better and to take away some of the angst and cynicism that occurs in our society today. So it's a big order, and we're moving forward trying to do this with looking at this whole issue, not social determinants, but we're now rechanging it to a healthy American ecosystem where all the parts and all the sectors are integrated and everyone has an opportunity to collaborate and to create viable solutions that are engaging. So that's hopefully that's enough on the social determinants of health to put us in a place where we can all go forward together and be productive.
No, thank you. That was extremely helpful and very informative in terms of providing your perspective on social determinants or drivers of health. And I kind of want to start with that question. Why did you decide to coin, or I guess use the term drivers of health instead of social determinants of health? And where do you kind of draw the line between those two phrases?
Well, I'm not drawing the line. I just have a belief that simple and elegant is more power than strong academic oriented words because you're trying to get to one and all. And every one of your families has different dynamics. So social determinants to me is a little pretentious. And I think drivers of health go right to the point. People know what driving's about. You try to get from A to B. And that's what we're trying to do here. Everything has to be simple. So little expressions like engagement is better than enragement. That attracts attention. Incomes are prioritized over outcomes. That's probably the core of our current fiscal thing. So I think we have to look at any issue with an economic system, perspective, as well as a perspective of what it takes to get people involved.
No, that makes a lot of sense. I think, yeah, there's a lot of jargon in healthcare, and keeping it as simple as possible would only improve and make things easier. Something else that you mentioned throughout kind of your talk was the importance of collaboration and just communication with others. I wanted to ask, who are you thinking about when you're thinking about stakeholders in collaboration, and what does successful collaboration look like to you?
Well, I think you went to school with me with your latter part of your question. Your question is better than my answer. Collaboration is sectorial and multi-personality type. So academia plays a role in this. Civic leaders play a role in this. Faith leaders play a role in this. Labor leaders play a role in this. Business leaders play a role in this. Technology experts play a role. But most of them, unfortunately, up to more recent times, live in their pillars. So the academic person lives in his academia culture, and how much they branch out into the general community is open for question. The technology people live in high tech and what that means and what's the return on investment. The civic people are elected, but do they keep the promise to what they said they were going to do? The faith, are they open to other people's faiths? So it's not my faith is the only one. They speak with authority, which is a word of certain religious groups. Are they open to listen to other perspectives? So that's the collaboration. Help me again with the second part of your astute question.
Yeah, what would successful collaboration among all these stakeholders look like?
Well, I would think, as I said earlier in this presentation, I would think bold. So have a big idea. So the SDHC has a bold sense of bringing people together. Okay, who are you going to bring together is the Stanford Health Design Challenge. It's challenging. Are you going to get the right audience there to collaborate? Is it going to be schools of community colleges? Is it going to be only quote unquote elite colleges? How much energy is going to put into it? Because as you know, I'm a big backer of your initiative. I think it's just phenomenally creative and I applaud you. And then how do you get it so you start small and get something done? Because otherwise people put in this thing, well, we can't do it, or they put barriers in front of you and they say no. My vocabulary is what I'm doing now. it's almost like I'm an emergency room physician, which I did earlier in my career. I have two words that I use over and over again. Some people respect it, some don't. Yes and no. So you came and you said, would I help SHDC do their things? And I could have said, no, I'm too busy. And instead, which I'm pleased with, I said, yes, let's go forward. So you make things a little bit less complex because you can always find a bureaucracy. You don't have a parking space. You don't have a key. You need to have clearance, whatever it is. You can make things more complex than they really have to if you really have a passion. So this week, soliciting sponsorship for my national summit, there was a major bank, I'd rather not mention the thing, and I was told, we're a no with you. So I got speaking with them, and halfway through it, the person who invited me said, we're still a no. And the two other senior vice president women said, no, you're wrong. We're a yes. We're going forward. So, people can pivot if you get them so they feel part of the team, not isolated. And that takes being kind and listening and feeling for the alternative force, not just your own presence.
Yeah, one of the really important points that I think you mentioned is that there's the importance of culture, right? And the differences of culture across America. And I'm from Minnesota. I see it all the time with the urban-rural divide. And often that difference in culture drives that divide, right? People in rural counties don't know what urban counties are doing, and people and vice versa, right? So what would you say to providers or industry and governments to try to bridge that gap? And how do you turn that divide or the cultural difference into an advantage to develop the next sort of generation of healthcare products or services?
Yeah, well, I would challenge you on one word. I'm more passionately involved in the word health than healthcare, because I think healthcare is along the ladder from sick care to healthcare to health. And I think you have to make it so everyone feels they're involved in the movement forward. So you have to make sure that one, you have better education for one and all. You can't make this an elitist thing either through the government system or the academic system. Philanthropy generally doesn't donate very much to rural issues. Rural issues historically have been a little tight, fostering change. When it comes to healthcare in rural areas, they have a shortage of providers, a workforce. They have a shortage of ambulances. And now over 160 rural hospitals have closed. So their model is not a very modern model. And I think we have to have on the national scene, we have to address from the bottom up and the top down. It's very hard to get money through the grant system if you don't have the staff to get it. It's very autocratic. It's very hard to get into the better system. So if you're in Minnesota, can you get into the University of Minnesota? Do people even know the research health program in Minnesota, which is excellent, by the way? And there's great data, but who has access to it? So you have to make sure that people have the appropriate way of learning. And I think what you're doing is another component. So my challenge to you, with all due respect, is how do we get your model to be populated to a larger population and share the bright spot stories that you're going to find, and then be honest and transparent of what the challenges are, what you're doing, because people don't want to hear only Peloton words. If you ride Peloton, all you hear is, oh, you're the greatest, you're the exercise. For me, I just think a touch of reality and sensibility. So let's go back to a word that I think is very important to answer your question, David. Two words: common sense. Do things that make sense for all, one and all, and have people come together collectively. And at the state level, you can have whoever the leader is, make it more open and accept disagreements in an agreeable manner. You don't have to agree with anyone, but you can find a hybrid and common ground, common sense to see things happen. And you can include public health and clinical care both at the table, not just academia, medical schools versus the county health department. They should be there. And guess what? Doctors can take off their white coats and go into the community. And guess what? For those who might be going to law school, you can take off your billable hour thought every day. Okay. I'm not picking on you, David, but each field has its own way of doing bill. If you're into mental health, the psychiatrists charge a fee per hourly service. So my way of thinking is a little pro bono service or a little philanthropic service or a little community service is all okay because we're all citizens of a quote unquote democratic society.
No, that makes a lot of sense. And I feel very wishful thinking, but I hope that happens. My last question for you is if you have any tips or pieces of advice for our people who are interested in competing in SHDC in terms of first maybe how to think about drivers of health or social determinants of health, where maybe gaps that they can think about in terms of innovation, service products, just in general, any pieces of advice you have for our participants.
I would submit one, have them know the prep sheet of expectations of what success looks like. Two, if you can share with them bright spot stories with some data and say, emulate this. Three, I would make it more societal oriented rather than just technological or health systems. That's just me personally. I don't think that having another app, there are hundreds of thousands of apps, which is a good app, which isn't a good app. AI is definitely something that's the word of the day. It's overplaced cryptocurrency, but have them realize who's making money and who isn't making money and what's the future of it. And be open to questions and answers. So be of guidance to these people, one and all, and make sure everyone gets some acceptance, or however you want to say, the acknowledgement of their presence in the process. Whether the winner or the lose, everyone should be seen as a winner, and give them some hope for the future, that this is not one and done. This is an inaugural Stanford Healthcare Design Challenge. And it would say, I haven't heard that yet. Is this going to be ongoing with a different group of people? So that's what I want. So far, I'm very impressed with the people I've met. But I would like to hear, those are the same questions I get for what I'm doing in Omaha. I get the same questions. So who's your sponsor? Where are you going next? What's the outcome? Are you going to create your Healthy American Innovation Commission? Where's it on media? Where do I get Q&As? Where's your website? Are you using LinkedIn? And how are you addressing the issue? And this is something I think is very important to you. What's the relevant use of social media in your design? Because right now, that's a big societal issue. Just because you're doing with YouTube or this, who's watching it? And do you know who's watching your challenge? I mean, I think that's pretty important to the larger frame. And then I guess the key question on a more domestic issue, how is Stanford going to applaud you for all the work you've done in a gracious way? I think you guys should be really given for what you've done and the challenges in front of you and the bureaucracy. It doesn't matter if it could be any school, whether it's, I hate to bring up other schools' name, but it could be Yale or it could be Stanford. I mean, or it could be Cornell or it could be Oxford. Okay. So all I'm concerned is that what you do is really, put out there and viewed. So we'll do whatever we can to communicate your story.
Oh, that's very kind. Thank you. I just quick follow-up on what you just were talking about in terms of we should be thinking more societal impact rather than technological impact. And sometimes the net benefit of creating one extra app might not be as much. So in terms of participants who are thinking about innovating in this space, what's your advice for, I guess, balancing societal impact and maybe profit or revenues or like how big the market is, chasing something that is a little bit larger and more abstract? I guess might not seem the most profitable compared to, or as easy to tackle compared to creating another app or service like that. So what's your advice for, I guess, striking that balance?
Boy, let me give you a compliment. That's a perfect question. Uh, uh, that's, I would say, out of politeness, that was a dagger question. Okay. So I think you're on a debate tonight on evening news. Um, um, you have to be holistic in your approach on who your team is. So they're different skill sets. So on this call, we have David with his background, and we have you and we have Lon and whatever. So you have so I think that when you create it, you have to do what I call a SCOT analysis. So what's your vision of what you're doing and why are you doing it? Okay, that's your vision. That's a one-liner, or your purpose. Two, your next thing is, what are your strengths? Strengths could be that you had a skill set in technology, you have a skill set in data analytics, you have a skill set in community development. What are your challenges? We're a little short. We think we're going to get rich quick, but we don't know how to market. We don't know how to sell. There's a skill set in selling. Okay. I mean, there really is a skill set. If you want to sell something, you have to know what the need is and listen to the client, not just yourself. And then your objectives. Have a clarity of what are your objectives. Even on this program, what are the clarities? That's why a whiteboard session is important. What are your objectives of where you're at? And what are your threats? You could say the leadership here is weak. You could say that the resources aren't available to do the project. You should say the commitment is really not there. There's a lot of lip service. So make sure, and also it's okay to do focus groups before you take a dive. So let other people tell you what they think of what you're saying. So someone could say, let's look at Phil on video today. Okay. And what I would say out of kindness is David gave me too much fluff in the beginning. And then you gave me a couple of hits at the end. Okay. Well, that's good. But that's edit. If you edit it, you got to get to the point where it has zip appeal. So when we're doing our summit, we have 3 words we use. Okay. So this will appeal to David and he'll smile on this one. We want to be optimistic, futuristic, and for David, we want a great deal of FOMO. David, you know what FOMO is?
FOMO as in like the fear of missing out, or
You got it, A+,
yeah,
because
thank you.
that's important. So it's like what you're doing with this. You want everyone to say, I want to be a part of the future of this Stanford Health Design Challenge. That's what you want. I mean, that's what you have to get. And whether your mentors are right or not, I would ask you at some other time, and you can edit this out, is which of those panel people you think are really pistols in presenting? Because I'm looking for great speakers, but they have to have the merit of what they deliver, not just who they are. Does that make sense to you?
Mm-hmm.
And they have to be the next generation of leadership because that's really important. But the younger people have to realize it's more than the debate now. Is it work life or life work? There has to be a balance. And you have to be willing to make a commitment, have a timeline for your commitment, and see results of what you do. And don't think it's all about me, 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 me. Think about us, 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 us. So I don't know if that answered your dagger question, but I appreciate it.
No, that was definitely very helpful. And thank you again so much for first taking the time and walking us through kind of your thought process and the many years of work you've put into this. We're trying to obviously cram it into 1 month of September, but getting your insights have been super helpful. And I think we'll probably get more questions in our Slack after we post this online, and we'll send those over your way if we get any to respond back to our participants. But quickly closing off, this week we have 2 more speakers, Matthew and Nikhil from Microsoft and Out of Pocket. So look forward to those. Don't forget to register on on LinkedIn or through our Slack and email for the register links. You can also find them on our website. And again, we want to give a huge thank you to all of our partners and sponsors, all listed here on our slides. So thank you